Hi guys, we're going to look at chapter 5, and this is going to be about cultural implications for that psychiatric mental health nursing. So we're going to dive in a little bit on how does culture affect our patient population when we're talking about our psychiatric mental health nursing. So we're just going to get started here. So the term minority refers to racially, ethnically, or culturally distinct groups that coexist, but are a subordinate in some way to a dominant group. We can also think about groups with numerical majority. They could also find themselves in a minority. So for example, the number of men and women are roughly equal in the United States, but women experience social inequalities in most societies. So yes, women and men are maybe a majority, but if we're talking about women specifically, that's where they may become a minority. Other minority groups could include the disabled, again, gender, and sexuality minorities. Minority status doesn't always mean it's fewer in number, but they lack political and social power. They may be treated differently and discriminated against. So just understanding the difference in minority and minority status here. When we talk about race, ethnicity, and culture, race can be defined as biologically, anthropologically, or genetically, can be distinguished visually from one another based off of physical characteristics. So this includes racial and national origins and sociocultural groups. Ethnicity is has commonality with heritage and history, and they may share worldwide worldview for thinking. There's an increasingly emerging group that do not identify in terms of a single race or ethnicity, and this is called multiple heritage, which can refer to our biracial, multiracial, bi-ethnic, or multi-ethnic individuals. And then the last term, culture, includes religious, geographic, socioeconomic, occupational ability or disability related, and sexual orientation related beliefs and behaviors. So when we think about measuring race and ethnicity in the United States, why do we do that? We do that because it helps us understand the needs of our citizens. That census helps us identify some of those disparities in healthcare along with those racial ethnic lines. So it just gives us that measurement so that we're able to intervene a little bit better as healthcare providers. So let's look a little bit at the basic world. On the next 3 slides, we're going to talk about different traditions. We'll look at Western, Eastern, and Indigenous cultures. And this is really broken down well in your book. Western tradition is where identity is found. They value autonomy, they value independence and self-resistance. We view mind and body as separate entities because they are different. They are different. Healthcare treats disorders of the mind and the body differently. Diseases may have a specific measurable and observable cause, but the focus is on treatment and elimination of that cause. Time is seen as linear and always moving forward. We expect people to show up on time, they're very driven, and success in life is obtained by preparing for the future. So that is our Western tradition. At our Eastern tradition, it's very different. It's very family oriented for that identity, for their identity. They view mind, body, and spirit all as one entity. Family interdependence and group decision making is the norm. Time is circular and recurring with a consistent belief in reincarnation. One is born into an unchangeable fate and dutifully comply not only to their fate, but what their family requires of them. Disease is caused by a lack of balance. It's the yin and the yang, or opposing forces causing that disease. And then the other is that ethic of care. We want to make sure we're promoting a positivity of that relationship. So you can see the difference is quite different between that Western tradition and that Eastern tradition. So what are some of the impacts of culture? We can think about nonverbal communication and etiquette. We can think about beliefs and values, or that enculturation, which is just that transmission of culture's worldview, beliefs, values, and practices to its members. Deviance from cultural expectations can be defined as illness by other members of the group. Ethnocentrism is a universal tendency of humans to think their way of thinking and behaving is the only correct and natural way. And the other impact of culture is that cultural imposition, which is just the process in which people or groups try to impose their own values and patterns. Some of the cultural barriers to mental health service. Communication barriers is always a big one, right? When you can't communicate with your patient, that becomes a problem. So the use of professional interpreters can be a tremendous help with this. Effects of stigmatization of mental illness. In cultures where the body and the mind are considered one entity, like in our Eastern tradition, or in cultures in which there's a high degree of stigma associated with mental health problems, people often view mental illness with a weakness or dangerousness that prevents individuals from seeking that treatment. Individuals frequently somatize their feelings of psychological distress, meaning psychological distress is experienced as a physical problem. And this can really lead to a lot of misdiagnosis because tools used may be inaccurate or healthcare providers are treating the symptoms without looking for the underlying cause. Some of the special at-risk populations that we can consider: immigrants and their families embark on a process of acculturation. So they're learning the beliefs, the values, and practices of their new culture setting that sometimes takes several generations. This process of adaptation is called assimilation. Immigrants choose to move to a new location in hopes to benefit by a change. Refugees are forced to leave their homeland to escape intolerable conditions, and cultural minorities are all vulnerable to discrimination and disadvantages. So the next few slides are going to look at cultural competence for the psychiatric mental health nurse. And we're going to go look at this display. So it's a 5-fold model, and we're going to really kind of hit on cultural awareness, cultural knowledge, cultural encounters, cultural skill, and cultural desire. So when we think about culturally congruent care or practice, that's applying our evidence-based nursing that corresponds with the patient's values, their beliefs, their practices, and their worldviews. Cultural competence is the process of demonstrating that culturally congruent practice. So let's again look individually. So the first one is cultural awareness. So looking at your own culture, your own biases, and recognizing the feelings that may appear during interactions with people. How were you raised and what similarities you have for your culture that you grew up with. The nurse being aware of culture alleviates some of that stereotyping and stigmatizing. It's also very important to recognize that there are 3 different cultures that are intersecting when you're caring for a patient in the hospital or the setting. You're thinking about the culture of the patient, the culture of the nurse, and the culture of the setting that you are in. And all of these can play a role in how competent you are. The next one is cultural knowledge, and this is how we really gain information of other cultures. You can obtain this by asking questions, studying on your own, attending cultural events or programs. You can forge friendships with diverse cultural groups. The one that is really important with nursing is developing a good rapport with your patient and asking those really good cultural relevant questions. We have to be willing to ask the questions if we want to know more about our patient. I think the biggest cultural experience that I could give you as far as an example is one of my patients. It was it's been years ago, high school football player, came in really dehydrated. And so we started talking about, what's going on, you're playing football, you're drinking enough water. And it came out that it was Ramadan, which is an Islamic culture. And it occurs in the 9th month of that Muslim calendar. And it's really during the day hours. They're focusing on prayer, fasting, and community. So in the night hours is when they get their hydration and nourishment. But during the day, it's quite different than our culture. And so if you can imagine football, right? He's focused on prayer, fasting, and community. During the daytime, he goes to football practice. He's going to become quite dehydrated. So it was trying to treat him while still taking into consideration his culture. So just being knowledgeable about that was very helpful. Different in cultural encounters will help the nurse deter from those stereotypes. It helps us gain confidence with those interactions in the future. It does help reduce or avoid saying something culturally inappropriate. All nurses can recover from cultural mishaps by taking measures to recover trust and rapport, by asking what caused the offense and then apologizing for any lack of sensitivity and willingness to learn. Cultural skill ability is always growing. We cannot know every aspect of every culture. We have to learn how to perform a cultural assessment in a very sensitive way. And your book has some really great questions that you can ask that allows that patient to feel heard and understood so that meaningful communication can occur. The goal at the end of the assessment is to mutually agree upon a therapeutic plan that is culturally accepted and capable of producing positive outcomes within their care. And then the final 5 mold model is cultural desire, and probably one of the most important ones. We need to have a genuine concern for our patient's welfare, willingness to listen until that patient's viewpoint is understood, and being very patient, considerate, and empathetic. If we have a desire to be culturally competent, this is one of the best steps that we can take for our patient. Short and sweet. If you have any questions about Chapter 5, you can shoot me an email or we can chat about it in class. Thanks, guys.